This is Anita Finley, and I am your host of Zoomer Times TV, presented by Boomer Times magazine. And I have a special guest for you today. This guest you don't usually see walking the halls of Broward Health Imperial Point because he's so busy in his office, but he is one of those take charge guys who will go to different places to see how everybody's reacting. His name's Randy Gross, and Randy Gross is the new CEO of Broward Health Imperial Point. And he actually is, let's see, you've been in with Broward Health with other physicians too, haven't you, Randy?
I actually joined Broward Health December 2019. First time with Broward Health as the CEO of Broward Health Imperial Point. And so started December right before the pandemic started.
Oh, lucky you, right?
That's right.
Well, but you've become famous because there's a lot of stuff that you're doing, a lot of stuff that's going on that's pretty exciting. I was telling everybody that the new ad that you're going to see in Boomer Times with this hunk of a guy on a motorcycle apparently had some bariatric operation. And why don't you start off talking about that?
Sure, we're very excited. Thank you for that introduction as well. And so
bariatric showed the picture to everybody.
There you go. There you go. I'm envious of the motorcycle there, but really a life-changing opportunity there. So bariatric surgery is one of the many services here we're really proud of. We're in pursuit, our facilities in pursuit of what's called Center of Excellence. It's just it takes your service to another level. So it's great coordination between our surgeons on staff. We have a bariatric coordinator as well, and just focusing on protocols, pathways to give the patient ahead of time the most informed, educated, and planned out, and then to make sure the recovery is great. So we have two bariatric surgeons, Dr. Choi and Dr. Zhang, who perform that surgery here at Broward Health Imperial Point, and really have some changed many people's lives.
Right, it's pretty good, but you know, everyone's afraid of going to a hospital. We know that. But I will tell you from being on the Broward Health Foundation board, what people do at Broward Health in the hospital, hospital administrators, is just filled with enthusiasm, intelligence, kindness. They have a wonderful reputation for this. And now meeting you, I can see why, because you're just an all right guy. I can see it from the kind of meetings I've been with you. But let me go back to something that we started talking about before we did this. You're very involved now in something new. There's called a Cath Lab. Explain what that is and why that's important, please.
Absolutely. So, about 2 years ago, approximately, Broward Health Imperial Point started their interventional Cath Lab services, but we're actually in the process of building a brand new state-of-the-art lab. And what that is, we have both a non-invasive, so when you go to your cardiologist, a non-invasive lab where they do stress tests, EKGs, we're building that lab, but we also have our interventional suite. So it's very important. Many in the industry, you hear time is muscle. It's very important that when a patient out in the community is having a heart attack, chest pain, and they need care, time is critical. So we have an interventional lab now, and we're building a brand new one. And what that is, it allows patients come in, be assessed quickly, and if it's determined they have blockage, right, they're not getting the blood flow through their vessels, the cardiologist, the interventional cardiologist can get in there and open up the blood vessels, do stents, and it's life-saving. And so our team does already great coordination with the EMS community. I get great feedback, and they appreciate how quickly they can get their patients in here and get them on the table and allow the cardiologist and the team there to provide that intervention timely, efficiently, and effectively. So it's a life-saving thing and a program we are very proud of.
That's great, and having you in charge of it, I know you're going to make it work. There's something else that I did want to share, that when you walk into the hospital, friendliness is really noticeable. Everyone, whether it's someone who's just finished mopping the floor, or it's a nurse, or it's a doctor walking down the hall, they smile, they say hello, good morning, whatever it is. That's a very important thing in a hospital, Randy.
Absolutely. One thing I pride myself in my leadership over the years is talking about being people-centered. And when I joined here at Imperial Point, I tell you, they just live it and breathe it every day. We like to use the term here, we give imperial treatment, and it starts from the front door to the operator, to the nurse at the bedside. There's just a sense of pride, a sense of ownership, and compassion. We love what we do, and it takes all of us to make it happen. And I think we saw it more than ever this year in the pandemic. While, look, I wish we never had to go through that, but we did. And I tell you, I saw our team, our medical staff come together more than ever. It's about showing that compassion, compassion and care to every patient that comes through the door.
And I told Randy this the other day. I did have my shots over at Broward Health in their big tent by that stadium. And I got to tell you, I have never seen such efficiency, such dedication, such kindness. It was extraordinary, Randy.
Mm-hmm. It's one of the most things that I'm most proud of. While we do great things every day, to be able to give back to the community like that, I can tell you our system, the Broward Health system, came together and said, we have to do this for the community. It's gonna be tough, but we got to do it. And literally the collaboration between the hospitals, our ambulatory division, our employed doctors, and others, the leaders, they came together working with the local soccer stadium. And I'm proud to say they're giving out almost 1,100 a day right there at the stadium to our community members. And it's been one of our many ways to give back to the community and try to get us back to normal life. And so we're really proud of it. Our staff are passionate about it. There's about 60 plus employees out there every day, Monday through Friday, giving that care to our patients. And they're really proud. Everyone's excited. There's good energy about getting the vaccine. And it's just one of our many steps to help us move forward and move us through this pandemic, hopefully.
So what you're saying, it didn't just happen. There's a lot of organization that had to occur to make it work that way.
No, it's incredible. You look how, like I said, the soccer stadium pulled together, our community leaders, Broward Health pulling the supplies, working with the government to get the vaccine, and our hospital staff, the physician staff, everyone just stepping up to volunteer their time, commit their time to really, it's an amazing coordinated effort.
And let's talk a little bit about patient safety.
Absolutely.
How are you managing that?
Another thing, and I appreciate you bringing that up, that I'm super proud of. This year, we got 2 recognitions that are, I tell you, they're hard to come by. We achieved a 4-star CMS rating. What that is, Medicare providers, there's evaluations that go out there to hospitals. They evaluate you from a patient safety standpoint, patient experience, your outcomes. Years ago, we were a 2-star and then 3-star, and now we received a 4-star rating by CMS, which is very, you don't see that too many of them in the whole state of Florida, as well as Leapfrog. Leapfrog is an independent survey group that was created years back. Insurance companies and large employers wanted to have their own survey method to evaluate providers in the area. So it's not something we pay for. It's a true independent survey. Years ago, we were a C and we moved up to a B. And this year, we just achieved a level A rating. And so we're very proud of it. I think there's only approximately 6 in all of South Florida from Boca down, and we're one of the 6 that have a level A rating. And once again, it's about patient safety, patient experience, outcomes. So what I love to share with people, look, we might be a small community hospital here, but we're powerful, we do great things, and our patients around us need to know they're getting top, excellent quality care.
My guest is Randy Gross, and Randy is the CEO of Broward Health Imperial Point. They do have, I think there are 4 other hospitals. They're just having a lot of new things happening there. And I know Randy probably has some other new things. Before you talk about that, I want to tell you something that you probably know. I know it was closed. I hope it's open. I think that Imperial Point has the best gift shop of all the hospitals. Are you aware of that?
It has a great reputation. I will say, unfortunately, through the pandemic, our volunteers program has been on a temporary hold. So right. I'm anxious for them to come back. But I tell you what, the volunteer program, they are our culture. We miss them. When I think about, you talked about earlier, the spirit, they're a big part of it. And we're anxious to have that population back, not just because of the gift shop, but just they help with transports and they help in our departments, and they're a big part of our culture. I was really proud when we were able to extend our vaccines to the volunteer members. They came back quickly in droves, and it's one step closer to getting them back in the hospital. But we do have a great gift shop. I do some of my shopping there as well.
Right. I mean, everyone should. For all the holidays, they have unique items, and they're very low priced. And I always rave about that, your gift shop everywhere.
That's
Talk
what
about
you-
other people don't do this, but if I'm around lunchtime, if I'm in the neighborhood of Broward Health Imperial Point, I drop into your cafe because your food is very good and it's very low priced.
They do a great job. And I tell you, they've been challenged
And
this year.
so actually, Cath,
Sorry, we were having a little delay there.
so there are always challenges, and I know that. It's hard sometimes, but the food is important, especially, to the resident, to the people who work there, as well as to the patients.
Definitely. It goes back to it takes everyone to take care of the patient, and food is a big part, right? I think we all need our nutrients, and they do an amazing job. Not just creating, delivering the food, but their interaction with patients to make sure that the patients are happy. And the food service department has been really had to reinvent themselves this year, though, with the pandemic. We had to change how we serve and deliver food, both to our staff and the doctors, all safety protocols. But it's one of our just many steps to make sure everyone's safe, is getting a great experience there. So they do a great job.
What else would you like to see happening at the hospital, or what is that I've missed asking you about?
Sure. So we've got a lot of great things. One thing that as a healthcare leader, we're really trying to express to the community, both the administration and the doctors community, is encouraging the community out there to seek care. There's a number of people during this pandemic, it's understandable. They're scared, they have fears, but I can't express enough the importance of continuing to seek your primary care, your specialist needed, get the preventive care. And when and if you need to go to the hospital, it's real important. I know there were some fears out there, but you need to know that your community hospitals are doing everything they can to make it a safe and secure environment for you. So it's more important to take care of your immediate healthcare needs rather than fearing what's going on in the pandemic. We take the right protocols. It's most important for you to seek that care. So we're ready for you. Our emergency department, we have a beautiful emergency department there that is eager and ready to take care of patients 24/7. So that's real important, and our physicians on board as well. Beyond that, I could tell you from a surgery standpoint, we're continuing to invest highly in our surgical services. Our Da Vinci, we have 2 state-of-the-art Da Vinci Xi robots for minimally invasive surgery. So we're providing some very complex surgery here and do a great job of that. So a lot of things to be proud of for your community hospital. We're here to serve you.
Yeah, the Da Vinci is very important. Will you explain a little bit about that? Because they're very expensive and not all hospitals have that.
Absolutely. And so primarily here at Broward Health Imperial Point, the Da Vinci robot is used mainly for general surgery procedures. Sometimes you'll see for hernias, a lot of GYN. We have a GYN oncologist on staff, does a lot of his robotically. So not every surgery, but there are certain procedures that the physicians, they feel they get better maneuverability, access, and it's incredible. You look at years past, how you had to have open procedures, right? And longer heal times for patients, recovery times. Now, many of these procedures that used to require you to stay in the hospital for days, they're done on an outpatient basis. Incredible outcomes and returning people back to their normal lives as quick as possible. So it's a great department of our hospital, and they do an amazing job.
And you really care a lot about the senior population. Your hospital especially is, you're in an area there at Imperial Point, a lot of seniors live there, and you actually have, I think it's a monthly meeting or every 2 months, and you bring the community together to talk.
Yeah, obviously under the pandemic, some in-person meetings have slowed down, but we're trying to reinvent ourselves and see how to make sure we, in our new pandemic social distance world, how do we connect? But as you mentioned, our fastest growing population in this area is the 65 and older, and we see that. We have what's called a niche certification, special training for our staff and the rest of the hospital to make sure we know how to care for that population, and because they have unique demands. And whether you're in the ER, whether you're surgical services on the floor, we want to meet and not only meet but exceed their needs. But the senior population, we love them to stay involved, whether as volunteers, whether as educating them about their health, and making sure they know they got a great provider in their backyard.
So actually, let me ask you, as a young student, a young kid, go back a little bit. What were you dreaming of becoming? Did you think you'd get into healthcare? Is that what you started with?
That's a great question. Thank you. Actually, I grew up in healthcare. My father was a hospital executive and a hospital administrator, so I kind of followed in his footsteps. I feel like I kind of grew up in it. And so it's something I always wanted to do, believe it or not. I remember being asked in 7th grade, and they were surprised I knew this path. And at the end of the day, I talked earlier about being people-centered. And I think that's one, again, that I love about this job is one minute you could be dealing with a housekeeper, a nurse, a doctor, a community member like yourself. It's such a diverse field to be in. And what's more rewarding, right, than taking care of patients. Even though I'm not an immediate caregiver, I help our team have the ability to care for those patients. And, there couldn't be anything more rewarding. So it is something I've always wanted to do.
That's great to hear that, because you see, that's important, that even though you're not the doctor, you try to make sure the doctors have what they need. Everybody has, everything that's going to make their job easier, and you have to be there to help them get that.
Absolutely. That's how, as leaders here, everyone has a role, and it's our job to make sure they got the tools, the resources, the education, the development needs to care for that patient at the bedside. And it's what we're all committed to. Right.
And so you do attract, if people are listening, if you want more information, go to browardhealth.org, and then you can go to Randy Gross, because this is Imperial Point. There's they have hospitals all over. I'm sure you heard of Broward Health North, and then there's one in Coral Springs, and then there's the General, and then I think you even have some outpatient ones, don't you?
Correct. Well, we have urgent care centers out there, and then we have, in our ambulatory group, we have a lot of physician practices out there. So a great coverage in the community to be there in many capacities. And then the Children's Diagnostic Treatment Center is also part of Broward Health, and they do an amazing job.
Why don't you talk about that for 1 second, because that's very important.
Absolutely. And, that's a whole nother story. They know a lot more, but unbelievable access to at all different stages of their childhood for developmental needs, whether it's hearing needs. I had the opportunity to tour recently, and they look at try to treat if they have mothers that are HIV positive, how to make sure you deliver a healthy baby, like I said, to early child development needs and diagnostic, dentistry. It's incredible the amount of services they do within their Children's Diagnostic Treatment Center to meet the needs of the children in our community. So I encourage folks. I really opened my eyes when I toured it recently, and I've been encouraging folks since to check it out. Go look online, go visit. The team out there does amazing things. They have a way to give food to families at times in needs, give supplies during school time. So there's whatever they can do to try to meet family needs to help these kids. They're trying to figure a way to do it. So I'm really proud to be a part of that.
Yeah, and I'm so glad that your enthusiasm just shines through this whole interview. It's wonderful to see someone like you, because I'm sure that there are a lot of hospital administrators who are really nice, but they're a little bit more subdued. But I like someone like you, because you're jumping out of your chair with all this excitement of what you have. So after you're there about a few years, I can see this whole building just rising up into the.
People say that, I've been doing this for over 20 years, but at the end of the day, they say, right, if you love what you do, you never work a day in your life. And look, this job and this industry obviously has its challenges. This pandemic's been a tough time, but when you can be there for people at a time of need, and you work together as a team in tough times and be there for each other, there's just nothing more rewarding. And so I'm really proud and really proud to be part of Broward Health.
And so are there any things that the public can do? I know they're listening, and what would you like to ask them to help you with in some way?
No, I think one thing is become informed about your health. Get your vaccine. Let's get things back to normal. Like I said, seek your primary care and your specialist. I think learn a lot about Broward Health. I'm biased now after being with the organization for a year, but it's a great hospital, great company, and we're here to meet and exceed the community's needs. We've been in this community a number of years, and we're just looking to how do we focus on each of our service lines to make them second to none in the community. So I encourage you to learn about it, learn about the Broward Health Foundation. That's a great way you can give back to the community, and they indirectly support each of our hospitals. So that's what I would
Right,
encourage.
that's great. Well, Randy Gross, CEO of Broward Health Imperial Point, you've been terrific. I thank you so much for taking your time today. I'm sure a lot of people know a lot more about it. And if you're looking for a hospital, you don't have to just, don't wait till you need to really go. You can go there, get a tour, go ask for Randy. He'll show you around. If you have any extra money, you want to donate it to a great hospital, please open up your wallet and put it in your will. Thank you, Randy.
You're so kind. You're so kind. I really enjoyed it. And thank you for your time.
Thank you so much. Okay, have a great day, and everybody get their shot.
Take care. Thank you so much.
Okay, bye, everybody.
Bye-bye.